nursing student. It looks like the physician ordered dressing change today. Can I get you to verify your last name and date of birth, please?
4/25/1994, Barassa.
Okay, I close my door for privacy and wash my hands and put on my gloves. Do you have any allergies while I look at the wristband?
No.
Okay, and I was in here about 30 minutes ago giving you some pain medicine. Can you rate your pain on a scale of 1 to 10 now?
4.
Is it okay if we continue with the dressing change?
Yes.
Okay, and I would raise my tray table up to my height and my bed up to my height, which they're both good right now, and I'd make sure I have my gloves on. And we do the push-pull method to take off this old dressing. We'd look at the dressing. There's nothing on the ABD, on the split gauze, some serous drainage fluid, which is good. We'd wrap it up and put it in the gloves and throw it away. We'd look at the dressing, the wound now, and it looks good. It looks like it's healing. There's not too much drainage. There's no odors or smells to it. So now we would continue with our 9 rights of Sterile Technique. I'd wash my hands first. And 1-inch border, sterile, touches sterile, nothing below the waist. Limit the time the sterile field's open. Fluid flows within the length of gravity. Skin is not sterile. Sterile water in the sterile bowl. Honesty, and don't turn your back on a sterile field. Okay? So now we're going to check the integrity of our packages. We check these too to see if there's any holes or anything like that in them. Expiration dates. Check the integrity of our packages. Expiration dates on all our packages, and they're good. We'd also check that on our sterile water. So now we'd back up and we'd open up our sterile cloth first. And we pinch the 1-inch border here. Round, up, and drop. We'd open up our bowl next, back up. Come in and drop. It's good. We'd open up our forceps, tweezers. Good. Now we check the expiration date of our water. We'd open it, lid up like this. We dribble out a little bit from the top here, and we make sure the label's in our palm of our hand. Come around, put a little bit of water in there, back, put that away. We'd open up our ABD, open like this, and clean it over. Open up our split gauze, clean it over, back, open up our gauze to clean it, over, put it back, good. Now we would do our sterile gloves. Come over, we pinch it, step back, put it on, come over, open like this, step back, make sure you have the pincher, hiker thumb. It's good. Now we can come in here and organize the stuff on our sterile field. Make sure you have everything on here first. The gauze goes in the water. We'd open up our split gauzes and open up our ABD. We would want to sacrifice a hand. And since our patient's over there, I would sacrifice this hand. Hold this, come over, clean off the dressing, the wound, don't overcross, and drop that in the garbage. Come over here, clean off the dressing again, don't drop it back, don't overlap, drop it in the garbage. These are dirty, so now they don't go over here. We grab our split gauze and we just drop it with commitment. Over top of it, grab our split gauze, drop it with commitment. We could let go of this now. This hand's dirty, so we put that behind our back. Grab our ABD, put that down. Now we can use both hands here, and we can tape up the dressing. Gloves are so sticky. And then we tape up both sides here. All sides. But when we clean the dressing, we would have looked at the dressing too to notice any drainage, any pink, any redness or anything. And after we cleaned it, the wound did look like it was healing. It had a healing tissue around it, and it was pink, and there wasn't much drainage. So we're good here. Is there anything else I can do for you today? I have time.
No.
Okay, stop.